A lot of times in medicine, I work in the healthcare. Um, a lot of people overprescribe prescriptions to treat certain like anxiety and depression. Do you think that is overprescribed, or could there be like other ways of going about it?
Think that depending on the mental health condition, sometimes the medications, it's not just that they're needed, but they are the most effective type of therapy. So I think that with some mental health conditions, like if we look at like schizophrenia, like that's something where we really know medication is kind of the leading evidence-based therapy for it that's the most effective. Now, when we look at things like depression, so what we really know is that certain types of antidepressants combined with cognitive behavioral therapy, that is the combination that has the most evidence behind it. Then PTSD. We know that with cognitive processing therapy and prolonged exposure therapy, that's even more effective than medications. So it really depends on the particular mental health issue that we're talking about. I would say, and this is just solely my personal opinion, but what I would say, especially now in a private practice and working more exclusively in the private sector and with community providers, I believe that access to quality mental health care and therapy is so hard that many individuals end up on medications because it's the quicker way to get an intervention to the person. And that is a systemic problem. But I would say that's just one thing that has been a real eye-opener to me in my transition from, the federal healthcare system to working in a private sector is the degree to which accessibility to therapists and skilled therapists and qualified therapists is really limited, and it's something that definitely needs to be improved upon within our country, without a doubt.